So Senator Smith and Senator Klobuchire and then Governor Walz.
Hello, everybody. Thank you for being here this afternoon. I'm Sarah Stace. I'm the President and CEO of Planned Parenthood North Central States. Our affiliate covers Minnesota, North Dakota, South Dakota, Iowa, and Nebraska. And also, of course, Minnesota is contiguous, as you know, with Wisconsin, where abortion is no longer available. After yesterday's decision, abortion is now only available in Iowa, Nebraska, and Minnesota. Most states, more states around us in our country are expected to ban abortion soon now that Roe is overturned. Yesterday's Supreme Court decision is devastating for the health and well-being of women and families all across our country. The damage that will be done is so vast that it is hard to describe the words, to find the words to describe what it means, both in an actual physical sense as well as morally. People will be hurt. They will die. Children will lose their mothers. Maternal mortality rates will skyrocket in places where abortion is not available. And we already have in our country maternal mortality rates that disgrace our nation in front of the whole world. In the meantime, I want to be crystal clear. In Minnesota, thanks to strong leadership by elected officials and the financial support of thousands of donors in our state, our doors are open, and Planned Parenthood is committed to continuing to provide abortion care along with many other essential sexual and reproductive health care services. We've been preparing for months to be able to best serve the influx of patients from across our region. But even with our best efforts, it's possible that we and others in Haven states will not be able to keep up with demand, and that's because so many clinics in our country are now closing. We expect that before long, 26 states will no longer allow us to save women's lives. And there just aren't enough other clinics and staff to immediately meet this great human need. Over time, our systems will adjust our capacity, and we're doing our very best now to hire as many staff as we possibly can. But the United States Supreme Court brought a sledgehammer down on women's bodily autonomy, freedom, and health. And now it's up to us to respond in the way we know to be moral and just. And so, I want to thank Senator Smith for her service as an executive and board leader with Planned Parenthood, and for her recent introduction of the Protecting Access to Medication Abortion Act. And I want to particularly thank Senator Klobuchire for her work on the Judiciary Committee. Although we did not have the votes to prevent the cynical confirmation of the 3 justices appointed by our former president, Senator Klobuchire shone a bright spotlight on their characters so that there was no mistaking who the Republicans were putting on the bench. And I want to thank Governor Walz and Lieutenant Governor Flanagan for their relentless pursuit of health equity, justice, and freedom for all of us, specifically including abortion and also all other health care, including birth control. And I know that Health Commissioner Jan Malcolm is here with us today too, and I want to particularly thank her as well. The Supreme Court decision puts power back in the states. So what does that do exactly? Well, it's the legislators and the governors. Governors like Reynolds in Iowa and Noem in South Dakota now have more power over women's bodies than we do. They have control over our reproductive health, so we must act now. We need legislation as soon as possible that protects the right to abortion in states. We need to pass the Protect Reproductive Options Bill and the Women's Health Protection Act. And we must also immediately strengthen our social safety net. The same politicians who are intent on stripping away our abortion rights have for too long gotten away with turning their back on providing affordable health care, daycare, paid family leave, birth control, any manner of supports that families in this country need. From this moment on, their moral hypocrisy just will not be tolerated. And in November, as a result of the United States Supreme Court action, voters will bring their own sledgehammer to this election. Thank you, and I'm now very, very pleased to introduce the senior senator from Minnesota, Amy Klobuchire.
Thank you, Sarah.
Thank you so much, Sarah. Thank you for your leadership. It couldn't ever be more important, and especially not just in Minnesota, but Sarah nationally knows a lot about what's going on in the Midwest. And I think that people now see, for those of us, Tina and myself, who have been warning about this for a long time, this is no longer a drill. It is really happening. And we are in a situation right now where my daughter has less rights than I had growing up, or even her grandma. So that's what's happening right now. And we're here to say that we are grateful for the governor and for Gwen and for the lieutenant governor, as well as for our health commissioner, Malcolm, because this is a time when we need people who are stalwarts for women's health. I have a cold, I'm not starting to cry. With that, I think that Sarah explained it well. The court went against 50 years of precedent on a woman's right to make her own healthcare decisions. And I think this all comes down to one fundamental question. Who are we going to allow to make these decisions? Is it going to be a woman? Do we trust a woman and her doctor to make the decision about her health? Or do we want politicians or the government or Ted Cruz to make that decision? That is the fundamental question before the voters in the fall and before the people of our state. The other thing about this that I can't stand is that it creates a patchwork of laws, as Sarah just described, across this country. We now have women in Minnesota have different rights than women in North Dakota, or women in Wisconsin will have different rights than people in Nebraska or than in Texas. That is not how this was supposed to go. This is 50 years of Supreme Court precedent, and literally the reasoning by the Supreme Court was that the word abortion wasn't in the Constitution. Well, the word woman isn't in the Constitution. The word contraception isn't in the Constitution. And if you read Justice Thomas's concurring opinion, you actually see the roadmap that he wants to take us down, which is a roadmap of looking again at even the right to contraception and gay marriage. This is an extreme court. But again, there's two things that give me hope. The first is that we're having an election in November, and the vast majority of the people in this country do not agree what these Republican-appointed justices did. The second is that we have Tim Walz and Peggy Flanagan to stand up for women's rights in Minnesota. And the other thing we have that no other state in the country has is that we have a senator in Tina Smith who is the only senator out of all 100 that worked at Planned Parenthood and that really understands this on the front line. And I give you my friend Tina Smith.
Thank you very much. Thank you. Thank you, Senator Klobuchire. Thank you, Governor Walz and Mrs. Walz. Thank you, Dan Malcolm, Lieutenant Governor Flanagan, and to my dear friend, President of Planned Parenthood North Central States, Sarah Stace. So yesterday, an extremist Supreme Court overturned 50 years of precedent
overturning Roe versus Wade and eviscerating a constitutional right to abortion. These 6 right-wing justices, 5 of them put there by presidents who did not win the popular vote, have said that not pregnant women, but government has the power to make crucial decisions, critical decisions, about whether or not to continue a pregnancy. They have said it's up to government to decide, not women. And they base this decision on the judgment of what men who were around hundreds of years ago would have believed about women and their freedom. Now, long before I was in the United States Senate, I worked at Planned Parenthood. I'm the only United States Senator with that experience, and in that role, I saw firsthand the capacity of women to make good moral decisions about abortion. And so yesterday, as the word of Roe versus Wade and the Casey decision being overturned, I was thinking of women sitting in clinic waiting rooms in Texas and Mississippi and North Dakota. Each one of those people has a unique personal story. Each one of them made a personal decision about abortion that was the right choice for them, the best choice for them. And they figured out how to get to the clinic, how to pull the money together, how to get time off from work. Some folks had traveled long distances yesterday. And these women weren't paying attention to the Supreme Court or politics. They were just trying to live their lives. And yesterday, they were sent home. They were told that it wasn't their decision anymore because some person who never would know them or their stories had decided that they, in fact, got to control what happened in that person's life. It is outrageous. 26 states are on the brink of severely restricting or outright banning abortion, but not in Minnesota. Minnesota is an island in the upper Midwest for accessing abortion care. In all the states around us, now or in the near future, abortion will either be banned completely or severely curtailed as Republican state legislatures strip away women's rights and as Democratic governors stand in the breach. Nationally, only about 40% of women of childbearing age live in states where abortion will still be legal, even if extremely difficult to access. And I can tell you, I know here in Minnesota last week, I had the opportunity to visit a clinic in Duluth, Minnesota, which has been caring for women, providing abortion care for women in northern Minnesota, northern Wisconsin, all the way to Michigan. And they are overwhelmed by the need. The Supreme Court has spoken, but they will not have the last word. The public is overwhelmingly on our side. The vast majority of Americans oppose overturning Roe versus Wade. Nearly 2/3 believe that abortion should be legal in most or all cases. And more Americans describe themselves as pro-choice than at any time in the last 25 years. And people are mobilizing. You can help by supporting Planned Parenthood and other clinics that are providing abortion care and other reproductive health care. In Congress, we support putting the protections of Roe versus Wade into law, and we will fight off the efforts of Republicans to put a national ban on abortion in place. This is something that Mitch McConnell has said would be on the table if Roe was overturned. We are urging President Biden to use all of his executive powers to protect women's access to abortion where it's still legal, and he's listening. Just yesterday, the Biden administration used its authority to make clear that FDA rules on medication abortion preempt state regulation. Now, this is important because Republican state legislatures around the country are busy trying to outright ban abortion pills or put unnecessary burdens in the way that are not called for by medical science. And yesterday, or the day before, I think it is now, I introduced legislation to put that rule of the Biden administration into law and protect access to medication abortion in places where abortion will still be legal. Now, medication abortion has been safe and effective way of terminating a pregnancy within the first 10 weeks of pregnancy for over 20 years. A provider can safely prescribe this medication over the phone unless there's specific circumstances, and it can be sent to you in the mail. In a post-Roe world, this medication will be an invaluable way of accessing abortion care. And here in Minnesota, with Governor Walz and Lieutenant Governor Flanagan, they have made it clear that they will protect the rights of all women to have access to legal abortion care here in Minnesota. This is a crucial act of leadership in this moment, and we are so grateful to them. Now, some will say Some will say that this decision overturning Roe versus Wade won't affect Minnesota, that Minnesota's constitution, because of the Gomez decision, will protect privacy and access to abortion. I disagree with that idea that it doesn't affect people here in Minnesota. It affects all of us. The actions of the United States Supreme Court show us, it is a timely reminder of how important it is that we have governors in Minnesota that understand the importance of this and understand that we can count on these governors. We can count on these governors to appoint to the Minnesota Supreme Court people who respect precedent and who respect the rule of law. Thank you very much, everyone, for being here, and I now am happy to turn it over to my dear friend, Lieutenant Governor Flanagan. Governor Walz. Sorry, Governor.
Also a dear friend.
Yes, exactly.
Well, good afternoon. I think for many, the last 24 hours have been reflective, tumultuous, stealing ourselves for a day that many of us suspected could come, but we hope never would. I would have to say, standing here with an incredible group of accomplished, innovative, talented women, I'm so happy that in 2022, this feels entirely normal to my daughter. But these women are firsts in so many ways. First statewide elected, first Indigenous woman, first sort of 3 governors in this, just so many firsts of the talents that are here, first Planned Parenthood, that is just the norm of what's there. And I think we should recognize these firsts came about because women had the right to make decisions about their own destiny, their own bodies, and their own choices. There were plenty of talented women 100 years ago, but they couldn't vote. There were no senators. There certainly were no Indigenous lieutenant governors because they didn't have that personal freedom to be the person they want to be and to hope and dream. The Roe decision changed all that. You could continue to teach school even after you were pregnant. Still can't get enough paid medical leave, but we're working on that part because that's all part of this. That's all what brings women into the workforce. It brings women into the sciences. It brings this talent to different areas that was closed off to them because we had the restrictions that didn't give them the choice of their own bodies and their own family plan. And I think today, just a couple hours ago, Gwen and I got on the phone with our daughter as she called. She's up in the mountains in Montana with a bunch of young women at camp, and she's their counselor. And they're hearing this news, and she's calling asking what this means. That beautiful, intelligent, vibrant, headstrong, everything I want her to be, with a world of possibilities in front of her to be whoever she wants to be, is now thrown back to a time that her mother never had to experience, and worrying about what this means. Imagining that a rapist has more rights than she does is absolutely an abomination. And I just want to say to all of those women, those parents, to all Minnesotans, to know, not on our watch in Minnesota, not with this team that's here, not with the people who care so deeply to make sure that those hopes and dreams are available, that this talent and these choices and the personal freedom that needs to be made. And I want to send a strong message to those providers here in Minnesota. We're grateful for you. We're grateful for the work that so many of you have done for so long. We're grateful for the folks who kept the stories alive to know that that decision yesterday didn't do a damn thing to prevent abortions. All it did was make them more dangerous and less accessible, especially to the people who need it. So don't be all self-righteous that you did something on this. These providers know what this carnage looks like. Sarah had it exactly right of what will happen and what will continue to happen. So I want to make sure here in Minnesota, we made the move this morning to use our executive orders on Executive Order 2216. And I want to speak especially to those that are seeking reproductive care, abortion care, and to those providers. This executive order requires state agencies to work together to find opportunities to protect Minnesotans providing or seeking abortions. We can get some specifics. Commissioner Malcolm can help understand what that looked like in the health department and other things. To the maximum extent of the law, it prohibits state agencies from using any resources to help in any investigation that would impose sanctions for providing or attempting to get reproductive health care services that are legal in Minnesota. And an absolutely dystopian thing that has to be stated is, it states that we will use all legal authority of this office to decline to extradite people who are charged under states' laws that criminalize providing, seeking, or obtaining reproductive health care services. You've got a family member in Texas who calls and asks what you can do to help them. That phone call subjects you to Texas felony laws for aiding and abetting someone to make their own personal health care decision. And I hope we don't get into the debate over there's some gray areas here, whatever. The outrage of this, we will stand for every single person to the fullest extent of the law to make sure that that never happens in Minnesota. And so for those of you listening, we will sign no bills that restrict. We have work to do, as you heard the senators talk about and you heard Sarah talk about here in the state. We need to rededicate ourselves to making sure that we strengthen all of those protections. And I absolutely agree, as you heard Senator Klobuchire mention, Justice Thomas laid out the roadmap for the further restrictions of our rights that will begin with contraception. They will restrict our right to marry who we choose to love. And I don't think it takes a whole lot of imagination. Whatever they decide to continue on is what they will do. So this issue about freedoms, about personal choice, about for the first time we've seen a right, a guaranteed constitutional right restricted to us, is here now. This is no longer theoretical, but what I can pledge to you, as I said again, with this team, with this leadership team, and as long as we occupy this office, access to abortion services and reproductive care will be safe, legal, accessible, and as affordable as we can make it. And I'm just glad that every single day that I go to work, that I learned a valuable lesson from the First Lady who said this, that a good skill in this job, and the Lieutenant Governor has echoed this, is if you're going to be Governor of Minnesota, either be a woman or listen to women. And in that case, I do. So Lieutenant Governor Flanagan.
Sound advice. Well, I'm honored to be able to stand here with all of these leaders who I respect tremendously. And I wish we didn't have to stand here today. Today is deeply personal. The right to decide whether or when to start a family is a deeply personal one for everybody. And yesterday, the United States Supreme Court said no. No longer does every individual get to make that deeply personal choice for themselves. But I, along with these people who I'm standing here today, am proud to stand here. And I believe millions of people stand with us in spirit, believe that each person, every Minnesotan, every American deserves the freedom to make their own healthcare decisions. And they certainly should get to make these deeply personal decisions about their reproductive health, including whether or not to get pregnant, to have a child, or not. For 50 years in this country, people in America have controlled their own bodies. They have had body autonomy. And now, that's gone. Yesterday, my daughter, Siobhan, felt it. She knew something was happening. She felt the buzz of all the grown-ups around her. And she asked me about it. Because that's what kids do. They ask questions, lots of questions. And so we talked about the importance of freedom, of people being able to make decisions about their own bodies, and how some people don't think that we should have that freedom, or that she should have that freedom. And she said, "Mommy, that's not fair." She gets it. Kids get it. And we should be unafraid to talk about this issue with our children. Because I refuse to do anything but fight to make sure that my daughter and your child have rights over their own bodies. She knows that depending on which state she lives in when she grows up, she might not be able to make the choices about her own body. And she knows that without the freedom to make those choices, she loses control of her own future. My daughter has fewer rights than her mother, and fewer rights than her grandmother. It is unacceptable. So I'm here to say no, not in Minnesota and not on our watch. Here in Minnesota, we believe that people have the right to make their own decisions about their own bodies, and we know what is on the line here. Reproductive freedom, the right to an abortion, the right to birth control pills, to IUDs, to safe and affordable healthcare matters. Our freedom to marry the person that we love matters. Our bodily autonomy, our body sovereignty matters. Our freedom, our existence matters. And the reality, and I want to be really clear about this today, the reality that Black, Native, immigrant, and low-income people are going to be hurt the most by this decision matters. And we know that is not by accident, that is by design. That is what is on the line, and that is what we are fighting for every day. Protecting these rights in law through executive action matters. So while the governor and I are in this office, we will protect that right for you to choose for yourself whether or not to become a parent. And we will fight every day to stop those attempts to roll back those rights. We will support measures like those my partners in this fight discussed here today that will solidify these rights into law and make sure that future generations of Minnesotans can depend on the same reproductive freedoms that I've relied on my entire lifetime. And that I hope my daughter and your daughter and our children can rely on too. Thank you.
Thank you very much. I think we're able to take a few questions if anyone has any, or anybody.
When it comes to the medical abortions, are you, by law, you can't send that over across state lines, correct?
That's correct. We can't send medication to states where abortion is banned. That's correct.
Can you, if somebody comes here and checks into a hotel, can you send it to the hotel's address? Is that an option?
Well, if they take the medication in Minnesota, that is legal. It is not legal for us to give medication to somebody and have that person leave the state. Because to take that medication in another state, for example, today in South Dakota, if someone came from Minnesota with the medication and took it, that would be performing an illegal abortion. So we will not do that.
Senator Klobuchire, I have a question for you. Earlier today, Joe Manchin and Susan Collins said they were misled by two of the Supreme Court justices during those hearings. Do you feel like those justices were misleading about their stance on Roe v. Wade? And do you feel like it's fair to say that someone could be misled by what they said during those hearings?
Well, I wasn't in their individual people, senators like Tina and I do. We have individual meetings with the justices. So
Do you feel
I
like,
just had, if I could, sorry.
Yeah.
I had one with soon-to-be Justice Jackson, for instance, and you ask them all kinds of questions. And I'm sure they asked them, and it appears that they had a discussion directly about this issue. So I wasn't privy to that, and neither of them are on the Judiciary Committee. What I was privy to was the answers. I asked Amy Coney Barrett about this, and she actually did say that she didn't consider Roe super precedent. That the other two, and I don't have those exact words, but I've looked back through the transcripts, they said things that would lead you to think that they would uphold these cases. And so it's very troubling, and my guess is they were more direct to them. But the point is, I didn't vote for these justices. because I could see how incredibly extreme they were in a whole host of issues, including antitrust. I know you want to hear about that today, but on a whole bunch of issues, they were very extreme, and so it wasn't really a hard call for me and many of my colleagues. And I'll note that Lisa Murkowski actually voted against Justice Kavanaugh. So there were people who were on to some of what was going on. But the point is now, rather than go back over that, for me, I am much more interested in what we're going to do going forward. And you have in front of you this impenetrable line of people that are going to stand up for women's rights and for reproductive rights in our state. And then you have November, which is the moment at which we could literally protect Roe v. Wade and codify it into law if the people vote who actually agree with us, which is many polls show 75% of Americans.
Commissioner Malcolm, is in the current reporting that goes on, the Department of Health reports the numbers of abortions performed in Minnesota. Do you track by state? Does it say which state the recipients of this medical care were from? Or is it just the fact that it happened and how many other abortions they've had? What is reported, I guess?
Correct. Our job at the Department of Health is just to report on the procedures that are performed. I think it's notable that we have seen record lows in the number of abortions performed in Minnesota. We're proud of our low teen pregnancy rates. Much work to do on health inequities there as in other areas, but I think this just underscores again the importance of reducing the rate of abortions the right way by making sure that people have education and access to reproductive health services and contraception. So thank you for giving me a chance to say that. In terms of the report, it's really just the factual report of the number of procedures. And we work very hard to protect patient privacy, so would not be revealing other details.
Sarah, do you have excuse me, you can go ahead and ask your question.
I was going to ask Governor, what options is the state looking into to enforce Minnesota's current rules on abortion before November? Are you guys looking into it?
Well, I think
does that have any pressure to a special session or anything like that?
Well, it's the CO does that. We'll be able then to refocus with the agencies what they're able to do. We'll make clear and spell out what our options are, especially on this issue of protecting providers and those receiving care. And then I think just making the case, I think Senator Klobuchare's point is well taken on this about looking forward on this. I think now we know, and there's folks that have understood this, that there's things we need to do to reestablish here in Minnesota some of those things. We know that, as Senator Smith said, there is a constitutional right. You're exactly right. Governors appoint justices, and they interpret what the Minnesota Constitution says. So I think for us, it's focusing on the existing state law to enforce that to the best of our ability on all fronts. And I think it's really important just this stability and the consistency here, as Sarah talked about. We understand they're going to get a lot busier, but I want to reassure those providers that the full force of this office in the state stands behind you, because what you're doing is legal and safe and necessary here in Minnesota.
One more? We can take one more one? One more question.
My question was about protecting privacy. I can imagine opponents doing surveillance of your sites and sending license plate numbers to other states that there's a crime and things like that. I guess you've got probably an operational plan going.
We do. We've been living with that kind of threat to security for decades, and so we are well fortified in that regard. Not perfect ever, but very well fortified.
Thanks.
Thank you all for
Yeah,
being here.
thank you.